I tore my ACL my first AAU game of my sophomore year. I went up for a layup and two girls smashed into me. I knew it was hurt right away.
I first met McKinzie when she came to my office. She had been hurt recently in a basketball game, and she'd already had an MRI, so we had that to look at, and we got to examine her knee. I could tell right away that it was very loose, and the MRI confirmed that she had torn her ACL completely. It also showed that she had torn her meniscus as well.
My first impression of Dr. Larson was that he was very tall. He explained everything to me, which I liked, and he made me feel really comfortable.
So we got her on the schedule very quickly. We knew we had to get her fixed up and ready to go back for basketball as soon as we could. We took her to surgery, and we had to repair her meniscus and reconstruct her ACL. In a girl her age, it's always important to use a graft that's as strong as it can be, so we actually used her own tissue. We used the tendons from the hamstrings, which are in the back of the knee, to actually form a new ACL and implant it into her knee. Now, we did this with the newest technique, which is called an all-inside ACL. So instead of the large incisions to take a huge piece of the tendon and bone from the front of the knee, we're able to use just a small incision on the back of the knee to harvest a single hamstring tendon. And then we're able to make the graft and lace it in through the portals that we would normally use just to look in the knee. We also repaired her meniscus at the same time. And with the combination of those two surgeries, we knew it was going to be a long period of rehab for her. We got to know McKinzie very well in her post-recovery phase because she had to do 6 months of physical therapy. We had her doing exercises at home right off the bat, and in about 2 weeks we got her into formal physical therapy. Now, because of the meniscus tear, we had to keep her from walking on that knee for quite a while, but after about 4 to 6 weeks, when everything had healed in well, we got her putting some weight on there and progressing with physical therapy. In about 3 months, she was ready to go. We had to keep holding her back. The graft isn't completely healed in at that point, and it's not as strong as it's going to be. So we usually have to wait a little bit longer before we're able to return the students to full athletics.
It was very frustrating. It hurt just sitting on the bench watching, but I knew if I didn't listen to him, I wouldn't heal correctly. I was clear to play the start of my junior year.
She was dedicated. She really wanted to be back playing basketball, and she was able to recover in fantastic fashion. By 6 months, she was strong, happy, and ready to go.
I'm really grateful for Dr. Larson and Valley Health for helping me get back to where I was before I tore my ACL.